the main topic that we're going to cover this semester is cancer. This will build upon what we started last semester, where we talked about cell biology. We talked about two important processes that happen for cell division in our bodies. We talked about mitosis for somatic cells, and we talked about meiosis for gametes, sperm and ova. This semester, we're going to talk about cancer. I'll give an overview. Dr. Med is going to, excuse me, sorry. Dr. Med is going to do a brief review to talk about the cell cycle and what happens when those checkpoints in the cell cycle break down, or what happens when you get dysregulation of the cell cycle. We'll talk about two important types of genes that help control the cell cycle, proto-oncogenes and tumor suppressor genes, so we'll revisit that. And then for this semester, again, our big topic is cancer. And so we have a female cancer that we're going to talk about, breast cancer, and we have a male cancer that we'll talk about, testicular cancer. And the rationale for choosing those two cancers were that we felt like we could arm the students with a lot of information that they could take away and actually take to their families, and being able to do things like self-examinations, and having more awareness of their own anatomy to discover that. I like doing questions, so I'm gonna throw some questions out to you guys. So, what's the most common cause of death in the U.S.? Let's do a little heart disease. Good. What's the second? Cancer. Good.
Yeah, cancer.
So that's another reason why we're talking about this. Cancer is the second leading cause of death in the U.S., so it's a big issue in our country. So that's the other reason why we were talking about this. What's the third cause? Stroke. Good. Cerebrovascular disease. Good. So let's move back to our cancer. So we're going to start with the female cancer. We're going to talk about breast cancer. What are the most common cancers in females?
Ovarian?
Breast cancer is number one. What's number two?
Dedicated.
As far as that.
Lung cancer.
Lung cancer. And then what's the third? Colon cancer. We'll talk about men in a second, so just know that that's coming. So those are the most common cancers, and so breast cancer is a big issue in our society. We're going to cover breast cancer in a very systematic fashion. We'll talk about the epidemiology of breast cancer. We'll look at a macro level. We'll look at some of the racial ethnic breakdowns of the incidences of breast cancer. We'll talk about the morbidity of breast cancers, in a racial ethnic breakdown of the morbidities from breast cancer. We're going to talk about the anatomy and physiology of the breast. So we'll actually do that multiple ways. We'll actually have a model. I have some cartoon images that'll show the breast so that the students can appreciate the different anatomy of the breast and actually how each of those different parts of the anatomy can be predisposed to cancer. We'll talk about signs and symptoms of breast cancer. Off the top of your head, what are some signs of breast cancer you probably could think of?
Lumps.
A lump, good. A lump or a mass. What other things? What other physical things could you look at that might be abnormal when you look at a tissue that might trigger you like, that doesn't seem normal, that doesn't seem like smooth skin? Discoloration, good. What else? Like dimpling. So dimpling the skin will cover those types of things. What about, so women produce what after they've had a baby? They produce what? They do what? They lactate. Right.
Yeah.
So should you lactate if you aren't of a reproductive, you aren't reproducing? Should you lactate? So discharge will cover things like that. That are some signs and symptoms that could potentially be signs of cancer. We'll also cover family history and risk factors. Many of our students may not know that they have risk factors in their own family. So I had 3 sisters who had breast cancer, so I have knowledge of medicine, and I asked all of them to make sure that they got tested for the BRCA gene. I did had them to do that also so that they could talk to their daughters to make sure that their daughters could get tested. My grandmother had breast cancer as well. So they need to know risk factors in their family history. And we have a little project we'll talk about a little bit later that might, for the parent-teacher breakfast, that might, that'll relate to that. We'll talk about diagnosing breast cancer. So what are some of the ways you guys know that breast cancer is diagnosed? Mammograms, good. That's what most people know. What other ways you think you could? Ultrasound, sonogram. What other ways? Tissue biopsy. So we'll talk about some of those things. We'll also talk about screening guidelines. Currently, did you have a question?
I was gonna say, you're probably gonna mention this, but I had a male colleague who had
Breast cancer.
Yeah, my dad had a lump on his breast. We'll talk about that.
We will, and a lot of times with men, there's a condition called gynecomastia, where maybe there is like a hormonal abnormality, and so you can get an increase in breast tissue that might be a mimic for breast cancer, but is really benign. We'll talk about that. We'll talk about treatment. So for breast cancer, we'll talk about things like radiation treatment. We'll talk about chemotherapy treatment. I did mention, but you can also get mastectomy. You can just have the tissue taken out, the cancerous tissue taken out. We'll switch gears and we'll talk about male cancers as well. We'll go through the same format. We'll talk about the epidemiology. We'll talk about the anatomy and physiology. We'll talk about signs and symptoms. We'll talk about family history, risk factors, diagnosis, screening guidelines, and treatment. What are the most common cancers in men? What is the number one? Prostate, good. Because I always remember, females have breast cancer. Males, we have prostate. That's our number one cancer. That's how I remember. What's the second? Lung cancer. And then what's the third? Colorectal cancer. So one of the other ways of discovery is that we'll show the students slides. We have slides that we've already have procured for looking at some of these things under the microscope. So I know that we had a seminal vesicle, epididymis, we had sperm. We'll look at some of these structures in the testes under a microscope so that the students can maybe appreciate that anatomy and physiology a little bit more. That is it for me right now. I'm going to let Dr. Mary talk about some of the activities that we're going to do.
So we are going to teach the students. We have breast models and we have testicular models from the nursing department, and also these, which I'm going to make more of these in They go, Maddie, Katie. Okay, so we're going to show them how to do a breast self-exam and a testicular self-exam. 40% of breast cancers are detected via self-exam. So when women should do this is right after their period ends, and we'll show them. We have those balloons, but you really need to do it in the shower or in the bathtub with soap and water, because you can't actually feel inside your breast very well if you don't have water and soap. And you can actually try to do that on those models, and you can't unless you have lotion or something. So the first thing is, we want them to be comfortable. You just have to look at your breasts and look at your testicles in the mirror, because a lot of the changes that occur are just simply visual, right? Dimpling of the skin, change in color of the nipple for males as well. Males can get breast cancer as well. And discolorization. And so you also need to become familiar with your breast, because there are certain ducts in there and lumps that may be normal. And then if you detect a lump, 8 out of 10 times it's not cancer. So we don't want them to panic, but you do need to go to the doctor and get it tested, right, get it biopsied. For the male, oftentimes, most of the time, one of the testicles is larger than the other one. And so just to become familiar with that and what they look like. And then it is really different to do a male self-exam. It's not so circular, it's more palpitating. And in the back is the epididymis, where the sperm collect and come out. And so the males have to become familiar with that, what that feels like, so they don't think that's a lump, right? And so then we are going to actually dissect bull testicles, which I don't know how big those are, probably like this big.
They look pretty
Uh-huh.
big.
And we'll show them the anatomy of the testes, which to me, I think they're gonna be kind of fascinated. Because females are done once they're born producing eggs, but males have this factory that produces 1,500 sperm a second, like their whole lives, you know? And I think it's really gonna be fascinating for them to see this factory. And I think our attitude, the more professional we are, and they're probably gonna ask a lot of questions. And so also, I'm not sure that most of them know that the sperm leave the testes, go up the vas deferens, up by the bladder, and that the urine and the sperm come out the same opening. I'm pretty sure they're not gonna know that. So that's gonna be kind of fascinating for them. So, are there any questions?
So then
You guys comfortable with this? I mean, we don't want them to be ashamed or think it's weird. Beta, you comfortable?
I'm just thinking about middle school kids.
Yeah.
But you know, we went over the cervix and we went over pap smear and they were really professional. I only got one odd question, but it wasn't really odd, it was from a high schooler. And he was concerned if the penis went up the urethra, what would happen? And I just simply said, that's not gonna happen, it's too small. And we just moved on. So, I mean, we're not really gonna be talking about sex, but I think some of that shame, like I told the last group, like, I'm not ashamed of my elbow. Why, or, you know, I don't mind looking at my wrist, where does that shame come from? Like, why would we Google when we're examining a breast versus an elbow, you know? I mean, it's your body and you need to be familiar with it. That's kind of our attitude, right? And, you know, we're doctors and nurses and, sure, some of them may giggle, but as long as.
Maybe the ones at my school, not as.
So just to segue though.
Well, these kids can't pick.
So the other part of this is we're gonna look at a lot of the epidemiology and we'll see a lot of disparities in kind of the cancer burden. We're gonna look at it again, like I said, from a macro level. We'll look at the statistics in the US, racial ethnic breakdown. We'll look at the state level. We'll look at even a more micro level and look at Wyandotte and Johnson County and just kind of flesh out some of the cancer differences between just two counties that border each other. And Dr. Mary, you had a statistic that you.
Yeah, it's public that the cancer death rate in Wyandotte County is 40% higher than Johnson County.
What?
Why do you guys think that's the case?
40% higher.
Because of I guess the food, the environment, health disparity. Yeah.
So we'll talk about some of those social determinants as well that actually kind of create those differences in statistics. So we'll talk about things like socioeconomics that could be a disparity.
Less
education
no insurance and annual checkups.
Insurance.
You know.
Well, but see,
Insurance
preventative.
access.
Mm-hmm.
You know,
You
and
never go
that's
to the
why,
doctor.
but most places, you know, if you're on Medicaid, Medicare,
They make
most
you go.
insurance will pay for a yearly exam and you don't have to pay for it. If you're on any insurance at all, and self-exam is free, right?
Right.
So that's the first line of defense. And so if we can get students to be comfortable with their, that's not a weird thing to be in the shower, feeling, you know what I mean? Like that's to save your life.
And we've had people from other classes, and I've known some younger people who've been diagnosed with breast cancer, but someone who told a story about when they were in college and they had a college mate that did a self-examination and found a lump, ultimately turned out to be cancerous. And so you can't be afraid to kind of explore our own bodies in that way.
And it's okay to look at your body, you know, and just to be familiar with it.
So
So that's the point. And
And
so
s-
we will be cool with it.
I'll tell people like when you for instance, for anything that you own, obviously you own your own body. When you go inside your house, you make sure everything's secure and safe. Same thing with your body or your car. You know what I mean? Your broken window, you wouldn't be just going and start driving. You know what I mean? It's been broken into. Change your body. You know what I'm saying? Something happens, you want to be alert about that.
absolutely.
Same thing.
Because that can affect outcomes.
Exactly.
So if you don't, if you're a lot of things with cancer, the earlier you detect them, the sooner you can get started on treatment and effectively, deal with it. If you don't,
Ignore it.
then you run the risk of the cancer becoming a bigger problem and possibly even metastasizing to places and causing, more damage. One last part before we go is that for the parent-teacher breakfast, we've been leaning towards doing having the students and their parents fill out a family history. So, just a show of hands, how many of you guys know your mom or dad's family history? Like, what kind of conditions your mom or dad have?
We did that DNA stuff.
Okay, what about grandmothers, grandfathers? Okay. So on the whole, many people don't. So, the story I've been telling tonight is that I see a lot of young, usually African American males who've had strokes. And usually it's because of uncontrolled blood pressure. So blood pressure is silent. You can't see it. It usually doesn't cause you any issues until there's actually a problem. And so hypertension or high blood pressure is a risk factor for having a stroke. Diabetes is a risk factor for having a stroke. Many people are walking around with these things and they don't even know it. And the first time that they're aware of it is after something terrible has happened. And so hopefully by arming our students with a little bit of motivation to know their family histories, they can collect this information and be able to sit in front of a healthcare provider and say, when they ask them, because that's part of what a physician or a nurse practitioner or PA will do, is collect your past medical history. Tell me what your past medical history is. Oh, I have high blood pressure, I have diabetes, I have rheumatoid arthritis, I have osteoarthritis, so on and so forth. So our students should feel comfortable and capable of being able to know this information about their family histories and actually tell a clinician about it, because it actually could prevent them from having something terrible happen to them. So, with that said, any questions?